What does it feel like to be a celebrity of the medical world?
Sometimes we are amazed at the reception we get.
Who is the boss? Me.
Well, it's obvious that I am.
Since we've got really into the book, I've regarded it as an integral part of my working life.
We really travelled mainly to the right, so to the east. Obviously India, Pakistan, Sri Lanka, then on to Hong Kong, Bangkok.
We were told we were going to give a lecture, and we have this sort of lecture which about the book, which either of us can start or whatever. And we walked into this very large lecture theatre where already there were apparently 700 or something like that, young medical students and doctors. So I thought it was much more appropriate that Parveen started. And she started by saying, "I am a Lahore girl." And the place just went berserk.
You've both got children who are going into the profession. So it's good.
Yeah, I have to say, if I had my time again, I'd do it again. I think it's a great profession. I mean, what do you all find? Are you enjoying it?
What we've always tried to do with the book is to make basic sciences understandable so that you can then take that on and go into the clinical features.
Can you tell us what's new in this edition that we can look forward to?
The section on the symptoms, and particularly all of the signs of all of those murmurs, that you've listened to and not quite been able to hear them, and all of we have reduced that down to a quarter of what it was. The number of times we meet people and the guy will say, "Oh yeah, I've got a copy of your book," and you say, "What colour is it?" And they say, "White." You say, "Oh yeah, that was the first edition. It came out in 1985. Yeah, that's the one. 87, sorry. Yeah, that's the one I've got." And I say, "Well, you do realise that we didn't have ultrasound in 87.
What do you think is the most important skill to pick up at a university?
Nous, by having been around in various situations, not just in the bar or on the rugby field or on the ward, but you need all of those skills, and you don't need any of them to to be to the detriment of others.
I just find nowadays medical students are all reading and bookish and don't do anything extra. Sorry, not all of them, but many don't do anything extra, and I think that's a detriment to themselves and to their patients, because unless you've experienced something, you're not going to be able to empathise with the patient. So you've got to see the stuff, you've got to actually attend. You should learn how to learn. And as Mike said, and I think above all, enjoy yourself. I think if you're enjoying it and having fun, then you're going to be fine, because you'll want to learn rather than it being a bit of a drag and sort of,
And then if you don't understand anything, you
ask
go.
Mike.
No, you go to the book.
What are your next plans in terms of publishing?
We're going to finish the handbook. The acute general medicine book, which is what we were talking about a few minutes ago, that probably needs to be updated, and then Pauline will discuss the 8th edition.
Okay.
But just warn you, don't write a textbook.
There's one sort of burning last question that Lucy and I would like to ask, and that's if you had one piece of advice for the next generation of doctors, the current medical students, what would it be?
Enjoy yourselves,
Absolutely.
and just be sensible about things. I mean, don't do when you become a doctor, just behave in a sort of sensible, reasonable fashion.
For God's sake, don't be arrogant. And the last thing really is always maintain your honesty and integrity, because once you lose that, so if you don't know something, say so. Don't pretend you know it and get it wrong. just own up to mistakes.
And always keep the latest edition of Kumar Clark by your bedside.